eventually we'll want to corral businesses that will commit to being that partner. We ready? Okay. All right, good afternoon, everyone, or actually good morning still for 5 minutes. Please continue to eat. We're going to get started so that it'll be a working lunch, an effort to get everyone out in an ample amount of time so you can get back to your lives. But my name is Michael Lazzara. I am the Mayor Pro Tem for the City of Jacksonville, and I am also the chairperson for the Oversight Committee for our Dix Crisis Center, which is very unique, and I'll talk about that in just a little bit. But what we're here to do today is to have a conversation about community collaboration and fill in the gap, what we're going to call the gap needs of the recovery effort. And so we're very excited about being here today and finding a community-based solution. I think we can all agree that we can't rely on government to fix all the problems. And this is an area where a collaborative effort is essential to have positive results. And we'll obviously have more discussion about that as we proceed. I would like to begin by introducing our guest speaker today. And Vanessa Sapp, who is with us today, owns and directs a private school in Sneads Ferry, serving grades pre-K through 8th grade. She is also employed by the U.S. Department of Commerce, where she collects data for statistics for the National Institute of Health and Center for Disease Control at the U.S. Census Bureau. Vanessa is also the co-founder of Sneads Ferry Hope, where she raises awareness and provides education and treatment options for substance abuse. She serves on multiple local, state, and national advisory boards and is a volunteer member of Onslow County's Quick Response Team. Vanessa is also a mother of 4 children, and she's here today to share a personal story about choices and consequences. Vanessa, thank you so much for your willingness to be with us today, and the floor is yours. Thank you.
Thank you. Good afternoon. Can everybody hear me? Kind of have a soft voice. I'm going to send some pictures around just because I think pictures are important to kind of go with what I'm going to share with you. Do you want to just kind of... As you just heard, I am the mother of 4 children, and today I'm here to share a story about my only son, Wes. Wes was a great friend, a better brother, and the best son. Growing up in a small coastal town here in North Carolina, we live in Sneads Ferry. Wes was a big fish in a small pond. He was an honor student, he was an all-star athlete, and he was a county champion. His senior year, he earned the VIP Athlete of the Year and was honored with the opportunity to speak at his graduation. He immediately enrolled in college following high school, where he quickly realized he was a small fish in a big pond. And this realization in Wes's need to belong drove him to rushing for a fraternity, which eventually led to him making some poor decisions, and he started smoking marijuana. Ending his first semester at college, Wes was, having been an A student, he was failing all his college courses. So we made a decision to not pay for a second semester and bring him home to kind of reassess. And that was very difficult for Wes because he was a people pleaser. And he became very depressed and didn't leave his room for about 6 months. And eventually he got a job with one of our friends who owns a local restaurant and started hanging out with his peers again and became his old self, his old bubbly self. But shortly after, I noticed a personality change in Wes, and I discovered that he had started smoking marijuana again. So we had a long talk, and I explained to him that it wasn't acceptable. We had 3 other children in the home, and if he was going to live in our house, he couldn't do that. So he made a decision to move out, and he stayed out for about a year. Our relationship was still cordial, but he just didn't come around a lot. And about a year after, he came back home and he said, "You know, Mom, I'm ready. I've made some bad decisions. I'm ready to get my life back on track. Can I move back home? And we took him back into the house, and that was in April of 2015. And it wasn't shortly after that he agreed to quit smoking marijuana so he could move back in the house, that he came to me and he said, he explained to me that he had a lot of anxiety and insomnia, and that's why he had been smoking the marijuana. And I talked to him about a doctor and some medications that he could take, and I did what I thought was the right thing. And I took Wes to see a doctor who spent a whole 15 minutes with him and decided he needed, I don't know, it was like 4 or 5 different medications. And Wes started taking those medications, but about a week or 2 into it, he came to me and he said, we had a good relationship, we had an open relationship, and he came to me and he said, you know, Mom, they really make me feel loopy. And the marijuana didn't do that, it just kind of took the edge off, and I don't like the way they make me feel. And I explained to him that it would take some time for his body to get used to the medications, and if that's what the doctor felt he needed, that's what he should do. He disagreed, and he again decided to move out of the house, and that was in September of 2015. We had a good relationship this time. During that time, he would come over and visit all the time. He'd bring his Xbox over, play with his sisters. During the week of Christmas, he had a week off, so he came and stayed in our house for the week. And after that, he decided he wanted to start talking about joining the military and wanted to turn some things around. And that was kind of his plan. And then mid-January, I got a phone call that he had had a seizure. And I immediately rushed over to his house. I took him to the doctor, and the doctor told me it was perfectly normal for a healthy 21-year-old to have an isolated seizure, that I shouldn't be too concerned. That didn't sit well with me, and I insisted on further testing. But 4 months later, I got another phone call on April 7th, 2016, and I was told that Wes was unresponsive and wouldn't wake up. We arrived at the house to find EMT there. They wouldn't let us go up to see him. They had arrived on scene and had announced him dead on arrival. The EMTs suggested that maybe he had aspirated in his sleep, but his girlfriend had shared with us that the night before, he had had a friend pass away just the night before. It was a young man who had struggled with drug addiction for some time, and he had overdosed, and he was on life support, and Wes was supposed to go see him the morning of the 7th. So that morning of the 6th, he had told his girlfriend he couldn't sleep, and so he was going to go to a friend's house to get something to help him sleep. She told us it was Percocet. She said he snorted it, he went to sleep, and he never woke up. It was about 4 months later that the autopsy report came back, and we learned that Wes had actually died of a fentanyl poisoning, and his death was declared an overdose. After Wes's death, his friends shared with me that he had been experimenting with prescription and other drugs, but his friends described him as a recreational or weekend user. And the reality is there is no safe way or recreational way to use drugs, and anyone is susceptible to overdose. A beautiful life was lost, and our lives are changed. There's a lot of collateral damage since losing Wes. Since losing Wes in math, though, there's some good things too. We started an organization called Sneeds Ferry's Hope to help spread awareness and education for those in need and to connect them with resources. In addition, our community has become very involved, and a local crisis center was opened. Our local law enforcement and community members are now trained in administering Narcan. Our county has a quick response team to respond to overdoses. Our local schools are providing opioid training to our athletes. And all of this is in an attempt to reduce overdoses, repeated overdoses, and overdose deaths. And while there's still some gaps, which I think we're going to talk about today, we are still working on those solutions. But I believe that our boys' lives are being honored through the work that everyone's doing, and lives are being saved, and I thank you all for being here today.
you so much for your willingness to share that story. I know that no one in here could imagine what you've been through and what you continue to go through, and hope that through our work that we can save a life. And if we can save one life, I think that everything will have been beneficial for all of us in this room. So thank you so much for that. Very impactful. You know, before we begin, I could look out in this room. Just raise your hand if you know someone that has had a mental illness issue or is struggling in some form or way. I mean, I think we can all attest that someone knows someone who is in a situation like this in a different way, shape, or format. So that is why we're here today. We cannot ask the government to take care of this problem on its own. There's many things that can be done, and we're doing that, but there's a responsibility from a community, and that's what we're here to talk about today. And I want to share just a quick paragraph from a community in rural Minnesota that I think summarizes it very well. Recovery is at its core a community process. Recovery is by no means a solo act. It requires a blanketing of protective factors while insulating oneself from the destabilizing effects of homelessness, unstable work, personal or cultural beliefs that are destructive to recovery, and learn social behaviors that are norms, all of which require community resources. Recognizing the need for stronger communities, and in response to distressing opioid-related trends, collaborative teams composed of community members, public health professionals, university faculty, law enforcement, medical professional, business community, and amongst others, have begun approaching the opioid crisis in rural Minnesota from the bottom up, building coalitions. And that is what we're here to do today and to talk about. I'm going to give a brief recap of where we are as a community regarding the Crisis Center and what we've been able to do. Through a collaborative effort between Onslow County, City of Jacksonville, Craven County, Carteret County, and through the help of Senator Harry Brown, we are very blessed to be able to open up the Dix Crisis Center, as most of you are aware of. It is a 16-bed facility, and as part of that, we have developed an unusual thing called the Oversight Committee, which we're very proud of. And what that means is that we believe that there has to be accountability in the recovery efforts. It shouldn't be just a money-making proposition for organizations to be involved in. So this oversight committee is there to ensure that the criteria that we set for them as a provider that are met, whether it is recidivism, drop-off times for our local law enforcement, and many other different criteria that we put together. And so we're very proud of that, and we're continuing to do that. Our statistics are doing very well. The provider, RI International, is doing a fantastic job, and we're getting great reviews. And the next level of that is the front of the building is our next phase, which is what we're going to call the 23-hour facility. And I'm not sure the capability of that. What did we say that could potentially seat?
According to RI, it's a 12 units of 12, so they would start with 12 and then see how
that goes. So that's sort of the next level of the Dix Crisis Center that we're in process of working on. But what we're here to do today is to talk about what we can do as a community and where we see the gaps are. We're having some gap studies done on a professional level, but we know right off the bat what some of those gaps are. And that's what we're here to talk about today. Corralling the faith community together, business people together, real estate people together. One of the things that we found is that when people are at the Dix Crisis Center, which is a 5 to a 7 day stay, it's basically a detoxification center to get people stabilized, to get them balanced to where they can make the decisions for what the next steps may be in their recovery efforts. And what we're finding is that many of them can't go to the next phase, which is potentially a 30-day program, a 60-day program, a 45-day program, simply because they don't have the $400 or potentially a $600 entry fee to go to these areas, to go to these centers. Transportation can be an issue. So through that, we have taken this initiative. We believe that that should not be an obstacle. This community can gather together and build a coalition where we can raise enough funds to provide enough scholarships to keep from someone that wants to get better from getting better. And that is what our efforts are here today as part of this process. We want to set a goal of at least $10,000 a year, if not $20,000, to be able to provide scholarships to those that want to get better, the opportunity to get better. As part of that is we want to build dignity. When they leave these centers, typically they just have the clothes that are on them. They've exhausted all efforts within their families. You know, what we hear is called tough love. You know, they exhaust all their local, personal resources, so they have no one to turn to. So we need to ensure that when they leave there, they have dignity so that they can go on to the next step and work on their recovery efforts. They shouldn't be clothless or not have the basic essentials like a toothbrush or underarm deodorant or shaving cream or all those little things that we all so take for granted. Clothing, we want to have clothing drives as part of this effort. We want to have the business community come together, that when they come back from a recovery effort, that we have businesses that are willing to be that business that says, hey, we will hire folks that are in recovery as long as they are doing well in their recovery and they can meet our needs. There's nothing wrong with a second and third and fourth chance. I know that within my business, I've done that on many occasions, and I've had some tremendous employees, because most of the people that are struggling are incredibly gifted individuals. They're extremely smart. They're extremely gifted in some formal way, and they can offer a lot to the business community, and we are all suffering from enough employees. I think even President Trump indicated that there's more jobs than there are employees to fill jobs, so that's a great problem to have. They need housing. If you don't have a place to live and you don't have any money, recidivism is but next. And we've got to figure out how to overcome that. We got to make sure we know where transitional housing is located. We need to ensure that we corral all this information so that we can set people up for success. Again, ministries is an important part, and our faith-based community needs to be a first-hand partner in this. And today we were graced enough to have Pastor Smith offer his church here to lead this conversation. And I'm going to turn it over to him for just a moment to talk about the faith community and what their role can be in this. Pastor Smith, thank you for having us.
You're welcome. There are probably two reasons why I was willing to be involved in this, and the first one was that Chief Yaniero asked me, and I have a lot of respect for him, and I know he's somebody that you can count on, and that he's a man of his word, and that he has a real heart for people. And as he shared the problem, I could see that he had a real passion for it. I know it's not just him. I mean, Mike and everybody that's been a part of getting Dick started, we've got good leadership. The second reason was that I'm not sure the exact history of it, whether it was in the 80s or the 90s when mental health facilities began to be taken out of service in our country, and now we have essentially a crisis of this scope. The justification for that was that the church and community would take care of that gap. And unfortunately, we've not been able or done what's necessary to step up for that. And so it's important that we do that. and Mike discussed the scholarships. Thankfully, I believe right now we've gained $3,000 already of the 10 to 20 that we would like to. And bringing a preacher, I guess it doesn't bother me to talk about money and to ask people for it. And so that's a part of what we're doing today. And we want to ask you, if you're ready to give, to let us know. I think Jill, right over here, registered you, and she's willing to circle your name and indicate that you're going to make a contribution and help make that next step possible. So please do that. If you know you can't do it today, then get back to the chief's office and let him know that you've got it established that you can do that. The other thing that Mike has talked about is a warm welcome back after long-term recovery. And the community's got to be willing to do that, both as far as jobs and housing. But nobody just wants to live in a house and have a job. You got to be welcome into the community. And churches are a big part of that. We have a ministry here called Phillips Park that focuses on homeless people, and of course drug and alcohol issues are a big part of that as well. And so and I know the churches that are represented here have lots of ministries that are focused in the same direction. And we've got to do our best to create an environment in both our churches and in the community that will welcome people who've had issues with drug and alcohol back into the life of the community. And we've got to be willing to be friends with them and to open our arms and our lives and our churches up to them. And so that's kind of what we want to happen.
Yes.
And want to encourage you all to do everything that you can. Those of you that are faith-based, that as the Lord speaks to your heart, make sure that, because that's what the chief and the others have been willing to do. They're not talking about it, they're doing something about it. And we've got to be willing to do the same thing. We've got to be willing to step up to the plate.
Thank you. Give him a round of applause, please. He's been very gracious. So what we're asking today before you leave is in the back, before you leave, if you are willing to offer your time, talent, or treasure, we need you to write your name down and what you're willing to do. You hear the needs that we're talking about. We're going to be doing fundraising. We're going to be doing clothing drives. We're going to be making what we're calling exit packages so that they have toiletries as they're heading to the next level of recovery. If you are willing to support transportation, most oftentimes they'll be able to link someone up with a recovery place, but the place may be 2 hours away, or it may be an hour and a half away, or it may be an hour away. But they have to have a way to get there. If they don't have a way to get there, they're not going to go. And remember, the time gaps is very narrow. When someone leaves the detox center after 5 or 7 days, they're not healed. They're very vulnerable, and they're going to be vulnerable for some time. And that is why it's so important that we limit the gap of time that they have without a warm handoff. We need to ensure that they can get to long-term recovery. We need to ensure that they have what they need to get there. And money should not be an obstacle. And when they get back, we need to have the groundwork laid for where we can help and assist them to find housing and to find employment, to find the meetings that they need to go to find the right ministry that they feel comfortable and at home at. That is how we're going to make a dent in this recovery effort. Because I can tell you, folks that have been through this devastating process, they have no self-esteem. I mean, they're at their lowest. There is no disease out there that is quite like this. There is nothing out there that is quite like this. You can have cancer, you can have anything, and people are warm. I'm sorry that you're struggling. I'm sorry this and I'm sorry that, and want to help you in any way. But when people are struggling with drug addiction and they've stolen from the people that they love, and they've wore out their bank books, and they've wore out every bit of love that they can take from the people that they love, they have no one left. But we all read stories about people that have gone through these year after year, 10 recovery centers, 15 recovery centers, sometimes 2 recovery centers, that have gotten the guiding light to change their lives and become incredible people. But we believe that that warm handoff and that gap has to come from a community-based approach. And we need the community to step up. Government can't solve this. We can solve this. We can make a dent. We can prevent a death. And if we can prevent one death, then we can feel good about what we've done. And that has been our approach at the Crisis Center and all the efforts that we've put in. So in closing, I want to thank all of you. I want to thank everyone up here that has taken their time to be with us today. I'm going to allow for a few questions that we'd be glad to answer, or some comments, or anything. Sir? I'm sorry, Robin?
Go ahead. That man right there.
Yes, sir.
Mr. Mayor Pro Tem, I am Pastor Frazier, Pastor Ray Frazier, Greater Faith Tabernacle, Richlands Highway. I've heard a lot of good things said today, and I believe that everything has been touched on has been something that is needful to help stem the tide of the opioid epidemic. We've got to understand that this is a killer, and it's not a natural killer. So no natural cure is going to work. It's got to be done in the spirit. Satan orchestrates this. And we have, this is taking place in the spirit realm. And the battle has to be fought in the spirit realm.
Thank you.
Nothing natural is going to heal this. All those things are good. Everything you said about the recovery and coming out and needing the community to stand with us in this, but we, the church, have to do this. This is our responsibility. Jesus Christ left his church in charge of this earth and told us to control it and to have a dominion over it. We're supposed to be in dominion over the earth, the church is. And everything he does in heaven, we're supposed to be doing here in earth. There's no epidemic in heaven. And if we do our job, there won't be one here on earth. But we have got to do our job.
Thank you.
We've got to introduce people to salvation. That's the only cure for the opioid epidemic. Salvation as offered through Jesus Christ. No other name under heaven given among men that this can be done through. The name is Jesus Christ. We have to get our people to commit their lives to Jesus. And when they do, they will say no to drugs. It'll make Sheriff Miller's job a lot easier trying to police the county. It'll make Chief's job a whole lot easier trying to police the city, because the people will have the law of God written in their hearts, and they will follow it when they commit their lives to Jesus. And this is where the church have not done its job. And I'm challenging the church today that let's step up and put a stop to this. We have the power in the name of Jesus to bring it to a squeaking halt.
Thank you.
We can stop it. He gave his disciples power over all the power of the devil. We have that power collectively, but we don't use it. And everything you suggested is a good thing, but it's not a God thing. And in order that you might better understand what I'm trying to say with this is, David wanted to build God's temple. That was a good thing. And God told Nathan, that is a very good thing he has in his heart, but it's not what I want. I've chosen somebody to build the temple for me, and I don't want him to do it. So what I'm saying is, what we've talked about are all good things, but they're not God things. This has to be done through the Spirit of God, and that's our job. God declared, if my people that are called by my name will humble themselves and pray and seek my face and turn away from their wicked ways, then will I hear from heaven I will forgive their sins, and I will heal the land. The land is sick because we're not calling on the Lord. We're not trusting the Lord. We're not keeping his commandments. When our hearts are right and satisfactory with the Lord works in our behalf. He does those things that nothing else on earth can do. And this is where the church has to come in and get involved. Until the church gets involved and begin to do what God left us here to do, it's not going to help.
Yeah.
It's going to get worse.
Thank you.
According to the 3rd chapter of 2 Timothy, Paul declared it would get worse and worse. And if we don't stop it, it's going to get out of hand. This is just the beginning. We have to stop it. It's like the California wildfires. Once it's lit, it has to be put out. It's not going to burn out. It has to be put out. And that's where the church comes in, to cast the demons out.
Thank you. Robin, Commissioner Knapp wants to say a word.
I appreciate what the preacher said, and I believe him. Coming from a law enforcement background, working narcotics most of my career, I've seen the other side. My wife's a mental health substance abuse counselor. She sees it, and she always tells me that you're not going to be able to get you're not going to be able to get help to people unless they want it. But here's the key, and I agree with you 100%, sir, absolutely. But it's a societal problem, okay? I was a narcotics officer for over 25 years, and I've seen it. Everything from crack cocaine to cocaine to whatever. The biggest problem that we had before I retired, the biggest dealers that we were pursuing and running investigations on were prescription meds. Heroin has been here since 1990 when I first arrived in Onslow County, because one of the first cases I ever did was a heroin case in Sneads Ferry. And I'm very sorry, Vanessa, for your loss. I really am. It's always been here. The problem is that society has buried its head. It's not a problem until it affects our society directly. And that's not the way it should be, from the inner cities to wherever. And if you haven't seen the effects of opioid abuse, you need to take a hard look. I was throwing drug dealers in jail, forgetting about the guys that they were affecting, the people they were affecting, until I opened my eyes one day. And I saw that these people weren't getting the treatment that they needed, that they were thrown out on the street, treated like trash, which should not have ever been done, because that's the way society looked at it. Society had an attitude, hey, it's not going to happen to my neighborhood, my family. Wrong answer. It'll happen to everybody, because there's no racial boundaries, no social economic boundaries when it comes to opioid addiction. My father was an Alzheimer's, a Parkinson's patient, and he had dementia before he passed away. I had him at home. He had surgery. He got a prescription of oxycodone. He took one pill. He didn't want to eat after that, and he says, go get me another pill. I could already see the effects on how quickly it took a hold of my father, and I forced him. I said, Dad, I'm not giving you that. You can take Motrin. And he fought me. So people have to realize that this is a real problem. We worked hard on the Dix Crisis Center, and that is a triage center for where we're going. Now it takes everybody. The government and private enterprises got together. We promoted we got the Dix Crisis Center up and running. It's a triage. It's not long-term. But now we have to focus in on the long term. What do we do with that? And that requires an infrastructure in place. And who's that infrastructure? You guys. Support. I mean, Mike Lazzara said it best. We have to find some place for these people to go, but we have to be constantly there to treat them and to give them the support that they need. Period. Because once you lose that support and care for them and they don't feel that they're being cared for, they're going right back to it. Okay? Tough love, as Mike says. It's very true. But so if we're going to blame somebody for this, we have to blame society as a whole, because we have buried our head in the sand too much. But now we need to make a stand and help these people. My wife had a client on Monday of this week. She got a phone call in the morning. It was a client that she had been counseling. She had to go to the hospital because her 29-year-old son just died of an overdose. And it broke my wife's heart, because she was trying to counsel him and get him the help we need. We need to be there, and I think this is a great, great effort where we have the county government, the city government, private enterprises working together to raise money to get these people in the right direction so that we don't have any returners, that we get them on the right road to recovery. Because if you ever seen an opioid person or someone addicted to opioid, it is really tough. I mean, people smoke, right? How tough is it for people who smoke to quit smoking? Because nicotine's an addictive drug. I did. I smoked for 30 years and I quit. It hurt, but I quit. Opioid is 10 times worse than that. And we have to realize that. It's a demonic, and I believe you there, Pastor, it is a demonic thing that's going on in this country right now. It's part of the devil's arsenal to take down our country. And now we're starting to get in front of the ball. We need to stay in front of the ball. We need that infrastructure. We need your help. We need people to donate. Like he said, we saved one life. One life. We've been successful because we made a difference in that person's life. So I solicit all your support. Billy, thank you very much for what you do in the food, and I know Billy is very active in this program. Please contribute, please, whatever it might be, whether you're there as a person to talk to for a particular patient, whether you have clothes that you want to get rid of, donate it. If you have money, donate that too, so that we can get these people on the right path for a greater chance of success. And I'm very passionate about this because I spent all those years arresting people. Now I want to spend the rest of my life helping these people to get the treatment that they need. So thank you guys, appreciate it.
Richard? Dr. Woodruff?
Thank you. As you've heard up front, government is asking you to help. If you look at the $10,000, $20,000 goal, you might say, well, government ought to be able to fund that. Let me tell you what government is funding on the Dix Crisis Center. $1.4 million for the next 3 years.
Yep.
We're not asking the churches or individuals to fill a small area. We have filled the large area. Under the leadership of the county and the city and the hospital here, we do have Craven County, Carteret County, and then the Carteret Health Facility, all working together. $1.4 million. So we're not asking y'all to do something that we haven't done. The government has stood in the gap. We now need you to take the gap a little further, because we can't take a sheriff or a police officer off the street and have them drive 2 hours to a center. Mr. Lazzara mentioned a while ago $400, $600. Really? Actually, that's all it is. You know, so many of the programs that you hear about, well, it's a $10,000 a month program. No, the number he gave is actually the real number. We're finding that there are dozens of people who get out of the Dix Crisis Center who want to go to a long-term recovery, and what's keeping them from being there is $400. Here's what I'm going to ask you to do. My wife and I pledged $400. We'll take care of one of those people this coming year. All I ask you to do is, you willing to do the same thing? Is your church willing to do the same thing? Is your business willing to do the same thing? We're not asking you to contribute big money. Please consider it. Thank you.
Thank you, Richard. Are there any other questions before we close that I can answer for anyone? I think this, Commissioner Price?
Mike, who do individuals or churches make the checks out to if they want to partner with you with these next steps?
Richard, can you help me?
Yes. We have a roster of people who attend. What we will be doing is getting information out to you very quickly. Very quickly means like in the next week on who you can make the checks out to. At this point, there has not been a 501c3 established. The city government, county government, we can't write these checks. It has to go through a 501c3.
You want to ask people
So
who you
we're
want to be
working
on the committee too.
What we're asking you to do is drop back by the beautiful young lady over here who is registering us, and just simply say, would you put a check by my name? That means you are willing to give, or we'll be sending you information within the next.
And we'll be following up, because as part of that, remember what my ask was, if you're willing to contribute not only monetarily, but in volunteer, we're going to need a committee that we're going to be putting together that's going to do a variety of things. So we're not just asking for money. We're asking for time, talent, or treasure, in any of those. Yes, ma'am.
My question is, and thank you for sharing, is the government keeping us from any type of spiritual counseling of any kind? No. And is there part of that in the treatment?
Absolutely not. Absolutely not.
No. what we'll be doing is we're going to be building the resources that allow folks to attend whatever ministry that they would want to go to. And basically, as part of this, is there's, as the pastor said, there's many different programs in the different ministries that are in Onslow County. What we want to do is, who knows about them? Who knows about what they provide? What we want to do is get all that information into one particular, for the lack of a better word, pamphlet, so that we can have this as a resource, because as part of the grant that we just received, we are going to have, Chief, help me on this, we're going to have 2 peer coordinators?
We will have 2 peer navigators.
Peer navigators.
Come out of the Dix Crisis Center and guide folks into treatment.
And so we want to make sure that we have the resources for them to be able to ensure that these folks know exactly who to turn to when they're ready to turn to something. Any other questions? Yes.
I'd like to, so I'm Tracy with True Justice International, and we serve survivors of human trafficking. Part of our program, hold on just a second, thank you. My name's Tracy Klein. I work with True Justice International. We serve survivors of human trafficking. Part of that program, and what we do is we have scholarships that we actually pay for girls that are survivors, whether it is human trafficking or prostitution, to get drug treatment. We pay for 90 days, and I'd like to find out who we can partner with, because we can offer some scholarships for these people if they qualify.
And what we're going to ask you to do, remember what I said, as you leave, please stop by and write down who you are, who you represent, and what you are willing to do for the organization. And we will take all that information behind closed doors and corral it all together, and we'll be reaching back out and sort of corral this back together.
Mike, if I could.
Sir.
The money that you donate will stay locally, and Pastor Smith has agreed, until we get a structure together, to at least be the hub of that money. So at least hold it to us until we can figure out what kind of organization we could have that could help us with those scholarships. So I appreciate the effort that you made to help, and I'll also emphasize, I think that, you know, part of the community is, when they come back, is getting them into ministries. I think that that's really been the success of a lot of these recovery-based services, is getting them into some type of ministries. And I know that we have talked a lot about different organizations, different groups, different treatment centers that are faith-based, and those have very good success rates. So hopefully we can locate those and direct some of those folks. And I know that some churches in this area do have some affiliation with a number of faith-based recovery centers. So I would encourage, if you know your organization, your umbrella organization has those, to let us know, that so that we can get folks into treatment.
Thank you, Chief. I have one quick comment from Commissioner Knapp, and then one other question, and then we'll close.
One of the things, you can hear me, right? One of the things that, if you look on the sheet, and I am going to brag about my wife. My wife's the president of the Coastal Coalition for Substance Abuse Prevention, and what she's focused in on is she counsels a lot of the opioid victims to include their family members, and that's a key integral part too. The family members are going through, like Ms. Vanessa here they're going through literally a traumatic event that doesn't just go away after a couple of months. And she offers a free counseling that she does free for families on Tuesday nights. And she does that because that's her part, because she feels strongly about this and she feels very dedicated to this particular issue here. So those are the kinds of things that you can do. And I fully support the faith-based treatment and counseling, et cetera. You know, one of the strongest things we can do is pray. We can pray for these people, and we need to do that. So please, I highly encourage everybody to participate. Even if you don't think you have something to offer, you have something to offer.
Absolutely.
Thank you.
Thank you. Yes, ma'am. One more question. Oh, I'm sorry, Sheriff. I apologize.
Hello, everyone. My name's Terry Hall. I'm one of the clinical managers for Emerge Ortho in Wilmington, and we do have an office here locally in the Jacksonville area, which we now offer, of course, pain management options for those patients who are struggling from not only their pain, but also trying to get them off of the pain medications that they're taking into something that's more reliable to help prevent addiction. But I'm also a member of the Academy of Medical Surgical Nurses, which is one of the largest organizations throughout the United States, and I'm a part of their legislative team. So it's really great to hear today that you guys were able to receive the funding from the government that we rallied so hard for about 2 years ago when that map came out of the opioid crisis and put Wilmington as star on the map. We are going in April to rally again on Capitol Hill for not only more funding for the opioid crisis, but also for gun violence. So it would be great if I could just kind of keep in touch with you all. If there's anything you would like our team to take. Like I said, it's nurses from all across the United States and some internationally, looking at things that nurses and our resource can help build within our community. So
That's wonderful.
this
Thank
is
you.
great.
Thank you,
Thank you very
Sheriff.
much.
We'll close it with you.
Thank you, Mr. Mayor Pro Tem. I'm so encouraged to see everybody here because we represent this community and how this community comes together and cooperates and collaborates with each other. We have the faith community, we have business, we have government, we have private sector. But I think one thing that we have to focus on is the new generation that is coming up, our children. And we have got to reach out to our young people and give them the information and do it in an appropriate way and let them know, things like if you go to a party, watch your drink, things like that. It's so important for us to reach out to that new generation. And how about we have a vision for a cultural paradigm shift where then it becomes uncool to even go down to the alcohol abuse or drug abuse. You can have a party and have a good time and you don't have to drink and you don't have to take anything, put anything into your system. And that's where I think the news media can help us out with PSAs, public information. If we can also reach out to the entertainment community and let them know we don't like some of the entertainment media that our children are subjected to. But it takes all of us to stand together, and I'm so encouraged that we have that in Jacksonville, in Onslow County, with our churches, with our business community, and with everybody else. Thank you so much. I'm very encouraged.
Well, thank you all for being here. If we can give one last round of applause to our sponsor, Billy Sewell, and Pastor Smith, and Vanessa for being here. Incredible story. And without any further ado, thank you for joining us. Please make sure you sign up for something on the way out, and we look forward to having a follow-up. So thank you very much.